Debunking 5 heart health myths you still believe and why they're absolutely wrong. Welcome to the US Health Guide. Have you ever wondered if everything you thought you knew about your heart might be wrong? Heart disease remains the leading cause of death worldwide, claiming a staggering 33% of global deaths in 2019. Yet dangerous myths persist, leading to complacency and missed opportunities for life-saving prevention. You might be unknowingly putting your heart at risk right now. But don't worry, today we're cutting through the noise. We're going to expose 5 common heart health myths you still believe and why they're absolutely wrong. Stick around because the truth might surprise you and it could literally save your life. Myth 1. Heart disease is only an old person's problem or exclusively a man's disease. This is one of the most pervasive and dangerous myths out there. Many believe heart disease is an old person's problem or exclusively a man's disease. This is absolutely wrong. In reality, heart disease can begin much earlier in life. Plaque buildup in arteries, the precursor to serious conditions, can start in childhood and adolescence. Even more alarming, nearly 1 in 2 US adults over 20 already has some form of cardiovascular disease. We're seeing a concerning rise in heart attacks among young adults, with a significant increase from 27% to 32% between 1995 and 2014. Notably, the largest jump was among women. For women, this myth is particularly deadly. Heart disease is the leading cause of death for both men and women. In fact, since 1984, more women have died annually from heart disease than men. Hormonal changes, especially the drop in protective estrogen during menopause, significantly increase risk for women. Plus, conditions like spontaneous coronary artery dissection, SCAD, which can cause heart attacks, affect healthy younger women far more often than men. Proactive prevention and regular screenings are crucial for everyone, regardless of age or gender. Start building healthy habits now. Balanced diet, regular exercise, no smoking. Your future heart will thank you. Myth 2. High blood pressure will show clear symptoms. This is another common and potentially fatal misconception. Many people assume their body will give them clear signals or symptoms if their blood pressure is dangerously high. But the truth is, high blood pressure is famously known as the silent killer for a reason. It often presents with no noticeable symptoms. You could have dangerously high blood pressure for years without feeling a thing. And if left untreated, it silently damages your cardiovascular system, leading to severe long-term problems like heart attacks, strokes, and kidney damage. The only reliable way to know if you have high blood pressure is through a simple, regular blood pressure check. Don't wait for symptoms. By then, significant damage might already be done. Early detection and treatment are absolutely critical. Myth 3. Heart attack symptoms are always crushing chest pain. Pop culture often depicts heart attacks as a sudden, crushing chest pain. While chest discomfort is a common symptom, this narrow view is dangerously misleading. Heart attack symptoms can be surprisingly subtle and varied, and this is especially true for women. A 2022 study found that a staggering 62% of women don't experience chest pain during a heart attack, compared to 36% of men. Other crucial warning signs to look out for include shortness of breath, nausea, feeling lightheaded, extreme fatigue, cold sweats, pain or discomfort in one or both arms, the jaw, neck, back, or upper abdomen. Women, in particular, often experience these less typical symptoms. Delays in seeking treatment, often due to unrecognized symptoms, lead to significantly worse outcomes for women, including higher mortality rates and more complications. If you suspect a heart attack, even if you're unsure, call 911 or your local emergency number immediately. When in doubt, check it out. Rapid medical attention is paramount. Myth 4. If heart disease runs in your family, there's nothing you can do. This myth fosters a dangerous sense of helplessness and fatalism. While a family history of heart disease does increase your risk, it absolutely does not mean you're powerless. Lifestyle factors have a profound and measurable impact on heart health, often significantly mitigating genetic predispositions. Think of it this way: your genes might load the gun, but your lifestyle choices determine if it fires. Behaviors like smoking, poor diet, physical inactivity, and excessive alcohol consumption contribute significantly to cardiovascular risk, and these are largely within your control. Adopting healthy habits, regular exercise, a balanced and nutritious diet, and effective stress management techniques can dramatically reduce your risk of heart disease, even with a strong family history. The American Heart Association recommends a comprehensive action plan. Get active, control cholesterol, Eat better. Manage blood pressure. Maintain a healthy weight. Control blood sugar. Manage stress. Get quality sleep. And crucially, stop smoking. You have significant autonomy over your heart health. Small, consistent, positive lifestyle changes add up to powerful risk reduction. Work with your healthcare provider to create a personalized action plan. Myth 5. Medication can fix unhealthy lifestyle choices. This is a dangerous misconception that can undermine the very purpose of your medication. Many believe that prescription drugs like statins act as a complete shield against the effects of unhealthy diet and lifestyle choices. Medications are a crucial part of a comprehensive treatment plan, but they are never a substitute for healthy lifestyle choices. Consuming foods high in unhealthy fats can directly counteract the effectiveness of statins and continue to contribute to plaque buildup in your arteries, negating the medication's benefits. The most effective ways to reduce your risk of heart disease and stroke are always a heart-healthy diet and regular physical activity. Research shows that combining aerobic exercise with drug therapy can yield synergistic effects, improving endothelial function and reducing epicardial fat thickness. Even for those on statins, exercise and weight loss have been shown to further reduce the risk of developing diabetes. Integrate your medication with heart-healthy eating habits. Strictly limit saturated and trans fats, processed foods, and sugary snacks. Prioritize fruits, vegetables, and omega-3 rich foods like salmon. Aim for at least 150 minutes of moderate-intensity aerobic activity per week. Always work closely with your doctor to create a safe, effective, and personalized plan that complements your medication regimen. Protect your heart. We've just debunked 5 critical heart health myths. Remember, heart disease affects everyone, regardless of age or gender. High blood pressure is a silent killer. Get it checked regularly. Heart attack symptoms are diverse, especially for women. Know the signs and act fast. Your lifestyle choices profoundly impact your genetic risk. Medication complements, it doesn't replace healthy habits. Your heart health isn't just about luck or genetics. It's significantly within your control. Embracing this knowledge is the first step towards effectively protecting your heart. Consult your healthcare professional for personalized advice, regular checkups, and tailored management plans. Proactive, informed health management is a lifelong commitment. If this information has empowered you, please share it with someone you care about to spread life-saving knowledge. And subscribe to our channel for more life-changing health insights. Which myth surprised you the most? Let us know in the comments.